Hey, how are you today?
Hi, I'm doing well.
Good. My name is Arlacia. I will be your nurse for today, okay? So I just need to pull the curtains and I'm going to wash my hands really, really quickly before we get started, okay? All right. So if I may, you mind if I identify with you your name and date of birth? What's your name and date of birth?
AJ 11 11 11.
Okay, that's perfect. Alrighty. I have AJ 11 11 11. So today your doctor or physician has an order for you to receive a catheter placement. Okay. So what that is, that's just going to be a catheter I'm going to place in your urethra, and it's going to excrete urine. Okay. Awesome. Do you have any allergies?
No.
All right. I'm just going to check the chart really, really quickly. Are you allergic to betadine, tape, or latex?
No.
Okay, perfect. All right, let's get some light in the room, and then are you comfortable? All right, let's get you positioned on the table with your legs up, okay? Awesome, let's get started. All right, so I have used my blanket to, just keep you covered here and for warmth. All right, and we're gonna come here and I'm gonna go ahead and get my items together. So for right now, this. Okay. Now, if we had a male patient, we would use this, but we have a female patient today. I'm gonna go ahead and get my gloves situated. Just gonna go ahead and put on my sterile gloves. Okay. I'm going to open my pack. I'm going to put my gel inside my box. Can you see that? Catheter ready. Okay. Now we are ready to move to my sterile field here. Okay, so start by opening the area that we're working in, and it's going to expose the area, the opening to the urethra. So I would take a cotton swab, and I would swab furthest away from me there, and then I would swab close to me, and then I would swab down the middle. Okay, and now we're ready for catheter placement. So I'm gonna go ahead, I already have it dipped in my lube here, my gel. So I'm gonna start placing placing the catheter. And I'm just gonna go until I start seeing the flow of urine into my catheter bag, which I have started seeing the flow. I see urine. Now what I can do is go about 1 to more inches, and then I would hold that so that it doesn't come out. And now we're ready to inflate. Okay, so my balloon is inflated, and I would take the same hand and I would go ahead and remove that, and I would give it a little tug just to make sure that that catheter is placed nice and snug in there. So for this part, what I would do is we would have what you call a stat lock, and I would place it on the inner thigh of that patient's inner thigh, and then tape it down, and it snaps, hooks on, so that this doesn't pull, cause any tension on the bag, and the bag doesn't cause any tension on the catheter. And I would place that bag below the patient's bladder so it can drain down into the bag, the Foley bag. So what I forgot to do was I forgot to tell the patient to bear down once I started inserting, but I did explain in the beginning. So now in order to remove that, I don't need sterile gloves on anymore, but I do need to make sure that the area is clean around the vagina and urethra area. And then so if I needed to, I would do some period care. And then also, if while we're here, if I had a male patient, I know I went 1 to 2 inches in for the female, I would go 3 to 4 inches in for the male, because their urethra is longer. So you would need 3 to 4 inches more. So again, I'm gonna remove the catheter. So I would have some clean gloves on after some hand washing, and I would let the patient know, hey, we're gonna remove that catheter. It's not gonna be, you're not gonna have as much pressure as you did before, but just bear down, and I'll let you know once it's out. So I'm now gonna deflate my balloon with that same syringe. Okay, that balloon is deflated. I have all my fluids back, and I would just hold that patient's labia open and get as close to the tip as possible so it doesn't fling everywhere. So now the catheter is out. I'm now looking at the catheter, making sure that the tip is still there, making sure there's no blood, purulent, pus, and all that good stuff. So now we can just toss this one. And yeah, if I needed to clean her up, I would do some period care, and that would be it. I remove my gloves, and that would be it. Thank you.